Friends, many people believe vegetables are healthy, so if you have diabetes, you can eat as much as you want. But in reality, it's not that simple. Some vegetables and plant-based foods may seem healthy, yet they can raise blood sugar levels more quickly than expected. That's why managing diabetes isn't just about what you eat, it's also about how you prepare it and how much you eat. Before we begin, let's understand two important terms: Glycemic Index, GI, and Glycemic Load, GL. The Glycemic Index measures how quickly a food raises your blood sugar after eating. Glycemic load takes into account both the GI and the amount of carbohydrates in a typical serving, giving a better idea of the food's overall impact on blood sugar. Understanding both GI and GL can help you make smarter food choices if you have diabetes. Let's start with the first food, potatoes. Potatoes are one of the most common vegetables in everyday meals, but people with diabetes should eat them in moderation. Baked potatoes, or potatoes that are cooked until very soft, tend to have a higher glycemic index, meaning they can raise blood sugar more rapidly. There is, however, a simple trick that may help. If you boil potatoes first, then refrigerate them for 8 to 12 hours before eating, some of the starch converts into resistant starch. Resistant starch is digested more slowly, which may help reduce the blood sugar spike after eating. Even so, portion control remains the most important factor. Next is corn. Roasted corn, sweet corn, and cornflakes are relatively high in carbohydrates. Eating large amounts regularly can cause blood sugar to rise quickly. If you enjoy corn, keep your portions small and pair it with protein and fiber-rich foods to help slow the rise in blood sugar. The third food is green peas. Many people assume peas are completely safe because they contain protein. While peas are a good source of protein and fiber, they also contain a significant amount of carbohydrates. Eating large portions at one time can raise blood sugar levels. This is especially true for processed or frozen peas consumed frequently. However, when eaten in moderation with other non-starchy vegetables, peas can absolutely be a part of a balanced diabetes-friendly diet. Now let's talk about sweet potatoes. Many people believe replacing regular potatoes with sweet potatoes automatically makes a meal diabetes-friendly. That's not entirely true. The effect of sweet potatoes depends largely on how they are cooked. Boiled sweet potatoes generally have a lower glycemic index and can be enjoyed in moderate portions. However, baked, roasted, or heavily caramelized sweet potatoes may have a higher glycemic index and may raise blood sugar more quickly. If you choose to eat sweet potatoes, boiled is usually the better option. Pair them with vegetables and a source of lean protein for a more balanced meal. Now let's discuss vegetable juices. Many people think vegetable juice is much healthier than fruit juice. However, when vegetables are juiced, most of their dietary fiber is removed. Fiber plays an important role in slowing the absorption of sugar into the bloodstream. Instead of drinking carrot juice, beet juice, or mixed vegetable juice, eating whole vegetables is generally a better choice. If you're considering drinking bitter melon or Indian gooseberry juice, talk with your healthcare provider or registered dietitian first, especially if you take diabetes medications or insulin, because these may increase the risk of low blood sugar in some people. Now let's discuss a food that is a staple in many households: white rice. Many people think avoiding sugar alone is enough to control diabetes. In reality, refined carbohydrates can also raise blood glucose quickly. Because white rice contains relatively little fiber, it is digested rapidly, leading to a quicker rise in blood sugar. This doesn't mean you have to eliminate rice completely. Instead, focus on portion control and eat rice with plenty of vegetables, lentils, fish, eggs, or other protein-rich foods. Choosing brown rice or other whole grain rice varieties may be a healthier option. Next, let's talk about carrots. Carrots are highly nutritious and rich in beta-carotene, antioxidants, vitamins, and minerals. Eating raw or lightly cooked carrots in moderate amounts is generally safe for most people with diabetes. However, drinking carrot juice or eating very large amounts of carrots may raise blood sugar more quickly because juicing removes much of the fiber. Whole carrots are usually the better choice. Another vegetable is beets, also known as beetroot. Beets are rich in folate, potassium, nitrates, and other beneficial nutrients, but they also contain a relatively higher amount of natural sugar. Eating small portions of beets in salads is generally fine for most people. However, drinking beet juice or consuming large amounts may raise blood sugar in some individuals. Once again, moderation is key. It's important to remember that none of the foods mentioned are completely off limits. The key to managing diabetes is choosing the right foods, controlling portion sizes, eating enough fiber and protein, and staying physically active. Now let's look at 5 vegetables that people with diabetes can include regularly in their diet. First is bitter melon. Bitter melon contains natural plant compounds that researchers are studying for their potential role in helping the body use glucose more effectively. However, bitter melon should never be considered a replacement for prescribed diabetes medication. Second is fenugreek leaves and fenugreek seeds. Fenugreek is rich in soluble fiber, which may help slow the absorption of carbohydrates. If you take diabetes medication or insulin, consult your healthcare provider before using fenugreek regularly, as it may increase the risk of low blood sugar in some people. Third are leafy green vegetables, such as spinach, cabbage, cauliflower, and broccoli. These vegetables are low in calories, high in fiber, and packed with vitamins and minerals. They help you feel full longer and may support healthy weight management, which is especially important for people with type 2 diabetes. Fourth is okra. Okra contains dietary fiber that may help slow digestion and reduce rapid blood sugar spikes after meals. Fifth is bottle gourd. Bottle gourd is low in calories, high in water content, easy to digest, and can be a healthy addition to a balanced, diabetes-friendly diet. One more important thing to remember: there is no single magic food that can cure or control diabetes on its own. Many people believe that bitter melon, fenugreek, or certain juices alone can normalize blood sugar. Unfortunately, that's simply not true. Successful diabetes management requires an overall healthy lifestyle. Regular walking or exercise, getting enough quality sleep, managing stress, and taking medications exactly as prescribed by your healthcare provider are just as important as making healthy food choices. It's also a good idea to monitor your blood sugar regularly. Doing so helps you understand how different foods affect your body and allows you and your healthcare team to make informed decisions. Remember, diabetes does not have to limit your life. With the right knowledge, healthy eating habits, regular physical activity, and proper medical care, people with diabetes can live healthy, active, and fulfilling lives. If you found this video helpful and learned something new today, please give it a thumbs up and share it with your friends and family. Don't forget to subscribe to our channel for more reliable, evidence-based health information. Thank you for watching. Stay healthy, stay informed, and take care.